name is Dee Doherty. I live in Ireland and I am a mom to two little boys, although they're almost 12 and 9, so I'd be murdered if I called them little boys now, but big boys. And I am living with stage 4 metastatic breast cancer. And I'm 38 now, but when I was initially diagnosed, I was 31. And my diagnosis was a stage 3 invasive ductal carcinoma and quite extensive DCIS, and that was in the left breast. Even though I have stage 4 cancer now, I am genuinely living a really happy life. Like things are good. I am working. I have loads of energy for my kids. I don't want anyone to be worried about what stage 4 looks like because it looks pretty good for me. But despite that, it wasn't always so good. I can't do it. And definitely in the beginning, being diagnosed at stage 3 was tough. And it's a long journey to get to this point.
Okay, I'm aiming to make a very short video today. I don't know if that's gonna happen though.
So my diagnosis story is a long one. I suppose actually what I will mention is that when I was breastfeeding my youngest child, I was not able to produce milk on the left side, which is the side that I ended up with cancer on. Now I saw a lactation consultant at the time, and what she told me actually really upset me. She told me I had underdeveloped breasts and that I wouldn't be able to feed him, which was, of course, really upsetting for me. I was a vulnerable mother with like a 4-week-old baby full of hormones, bawling my eyes out. But it didn't make sense because I had breastfed my first child, and obviously, like, your breasts grow when you're breastfeeding, and we're like a D cup at that stage. And then I was perfectly fine feeding my second baby, Ashton, on the right side. So even though what she told me, I accepted it, it didn't really make sense. So I do wonder, was that the first sign of it? But what I know to be the first sign was actually breast pain. So I had a pain that was palpable. I could find exactly where it was in my chest. And that was in July of 2017. So I went to my A&E, so accident and emergency, to get myself checked out. So they did a few tests. They did some blood tests. They did an x-ray of my lungs, and they did an ECG. So ECG was fine. My heart was fine. And I had said to them at the time that even though this pain is here and it radiates around the back, it's not my heart. You know, like, I go for runs and I never have this problem. That's not what it's from. But all they really wanted to look at was a cardiac pain, when even though I had told them that's not what it was, that's what they were looking for. And they also told me that my bloods were normal, and they sent me off on my way. Now, actually, I have the benefit of hindsight now. I got my medical records and I saw those blood tests, and they actually weren't normal. So, for example, my neutrophils were elevated, which, amongst other things, is a sign of cancer. The same with my white blood cell count. Everything was kind of off, but they told me it was normal, sent me off, and I just said, I'll just get used to this pain. I've been told there's nothing wrong with me. Fast forward to October of 2017. and I was sitting on my sofa watching TV. I was in my jammies and just chilling, and you know the way you'll just sit with your hand like kind of like this inside your top. So I was sitting like that. I had my arm up, and I just had my hands. You can't see my hands, but here, okay. And as I was feeling it, I could feel this lumpiness along the side, and it felt sort of familiar because I would have had blocked milk ducts when I was nursing. And just incidentally, after not being able to breastfeed Ashton on that side, some of that lumpiness never actually went away, but I would have been told it's normal. It's just what milk ducts are like. The reason I was concerned about it is because of how lumpy it was. So while I say that kind of thing was familiar, it was alarming, you know? And I started to think to myself about like, oh, but hang on. Breast cancer is a lump in your breast. So I moved my hand across, and sure enough, there was a huge lump. I mean, you know how even a spot feels huge under your fingers. So like, to me, it felt enormous. And I didn't know anything about breast cancer. I really didn't.
So as you've probably guessed from the title of this video, I have got breast cancer.
I made an appointment with my GP. So we say GP here, it's your family doctor. I went along to her, and she gave me an urgent appointment, saw me, and she was really concerned about it. Okay. And so now this is where the problems started. Not with her, she's amazing. Okay. But in Ireland, our healthcare system, our public healthcare system, is kind of in the dark ages. So she did a referral for me to the National Symptomatic Breast Clinic. But she knew I would not be seen urgently because I was under 35. So an urgent clinic would see you within 2 weeks. An early clinic at that time would have seen you between 6 and 8 weeks. And then the next one would be 12 weeks. So then as well, bearing in mind that the pains had been there in July, the short amount of time that had happened until there was a huge amount of lumps, like for me, every day mattered. I made countless phone calls to the hospital. I was begging with them. On one occasion, I was crying down the phone saying, I'll come at any time. I will, at the drop of a hat. You tell me you have a cancellation, I will be there, And I was like, I know what this is. I am so scared. Like, I have 2 young children who at the time were 2 and 5, and I was like, I can't leave this any longer, And then on the phone, they said to me, listen, we do this all the time. You've been triaged, and we've made the assessment that you are not urgent. And as for being worried, every single person who comes to this clinic is worried. So it was pretty much like, get over it, Finally, I did get my appointment to go into that clinic. And the expectation was that I would go for a triple assessment. So I know that some other countries do call it a triple assessment, but just to explain, it's that you go along and there would be the ultrasound, mammogram, and a biopsy if necessary. But that is not what happened. So I went in. I met with the breast surgeon, and he gave me an examination with his hands, and he told me it wasn't cancer. So, understandably, I was upset. I said to him, I should be sent for imaging now, that there's no way that you can tell me that I don't have cancer by touching me with your hands, And my mom and dad, who are amazing, were with me in the hospital that day. So my mom actually approached a nurse and said to her, surely there's some way that we can get around this to get her an ultrasound. And she was told you could go over to the private hospital and pay for a private ultrasound and then have the results sent back here. So my parents believed in me, I suppose. They knew that, that they encouraged me to trust my instincts, and we did do that. So within a couple of days, I had the scan in the private hospital, and the first part was an ultrasound, and I don't even think a full minute passed when she just lifted it off and she said, okay, yeah, no, we need to biopsy you. And without saying the words, she told me I had cancer, So because of the whole health insurance part, she couldn't actually continue that there in the private hospital. But what she did do was she went herself to the public hospital. I met her there and she did the whole thing herself. So this woman is in all my videos, I've never mentioned doctors' names or anything. She's the only one whose name I have mentioned because I'm even going to get emotional about her now. She's the person who saved my life, basically. So she called one of the nurses down from the breast clinic and immediately gave me an appointment for 2 days later. So the fact that I had the appointment for 2 days later, I already, that was for them to tell me the official results, So I went along to that appointment with my dad, actually, because the person who I was going to meet was that original doctor who told me I didn't have cancer. Then basically he just said, I'm sorry to tell you, but you have cancer. And that was how I found that out. My first question actually was, does this mean I won't be able to have any more children? So my treatment plan was so I did neoadjuvant chemotherapy, which is where you do the chemo before your surgery. Then I had a mastectomy, and then I did radiotherapy. So my chemotherapy was ACT, so the AC being the red devil, as it's often referred to. And then Taxol after that. Chemo was pretty grueling. It was bad. The first one was pretty bad because I really didn't know. My sister told me at the time, you're in denial if you think you're going to be okay with chemo. And I said, oh, it's going to be fine. I'm pretty resilient, that kind of thing, I talked about chemo. I talked about the side effects, and I talked about, tips for getting through it. And I did get through it, and I'm a big baby. If I got through it, everybody will.
Just look at it. You can see how it's sticking out in places. The reason it's sticking out is because it's literally just sitting there.
And then I had a bilateral mastectomy and an axillary clearance. So all of the lymph nodes were cleared from under my arm. The cancer was super aggressive. The chemo had some effect on it, but they did find once they biopsied what they'd removed during the mastectomy that it was a higher grade even than they had initially thought. And I didn't have clear margins either, so there had already been some invasion of the surrounding tissues, which meant then that I went off to do radiotherapy. Now, I'm going to tell you something. Most people think radiotherapy was the worst part of their treatment, and it was the absolute best for me.
All of the measurements are coming off in a light from the machine on your skin, so they can see exactly that, you know, everything is lined up properly. They check things like that your chin is out of the way of where the radiation will be given, you know, so that it wouldn't be done like that or something.
See, the thing is that when your active treatment ends, particularly if you've ended on radiotherapy, because that's something that you were doing every single day of the week. You're traveling to and from hospital. It's almost like, I mean, you're commuting. It's almost like you have a job, you know? So when that ends, you truly are at a loose end, you know? And I didn't realize for a good few years afterwards, but what my problem ended up being was that I had lost myself, my own sense of identity. I didn't know really who I was anymore, you know? And there is this thing where I was D, and then I was D after cancer. And that, you know, that it was kind of like, well, who is this D after cancer? Because she is not that girl. And it's true. You're never going to be that person again. But that's okay, because you know what? I actually don't really like that person anymore. You know, when I've come out fully on the other side, and I was so obsessed at the time with wanting to be her again. But that's not the way life works. You're not a toddler forever. You're not, you know, we evolve. Things change, you know, you grow up. And for me and for so many people, cancer is one of those things that makes that happen, that causes that evolvement of you as a person. You end up with PTSD. Like, I was diagnosed with PTSD afterwards. And then I started to, because I was so mentally unhealthy, I was reckless in my behavior. I just, you know, you nearly think like, oh, the worst thing that could possibly happen has already happened. So what does it matter? You know? I then, you know, it's no secret to anybody who's seen anything of mine before that I was in such a low place that I genuinely thought that the world would be a better place without me. You know, I'm not like that at all anymore now. Like, I'll just make that clear. You know, and especially because, like, if you think about it, like, my kids are everything to me. Like, I love my children so much. When I became a mom, I like, motherhood was just the best thing that ever happened to me. I was like, how did I live before having kids? Having short hair, losing a breast, not having any estrogen, you lose your libido, you become insane with the hormones, angry and everything. You are not yourself anymore. You're not yourself. And it's really hard to navigate. It's so hard. Remember I said that my first question was, will I be able to have any more children? And I was told no. That void was there. That void was there in the family. It really felt like there was something missing. And it was something that they were feeling and I was feeling. And I came across a study. The study is called Positive. I went and I read all of these journals. I had all of this research and I went into my oncologist with it and with the plan. I want to pause temporarily my hormonal treatment to see if ovarian function returns with the hopes of having another baby. Excuse me. Now, I was expecting an argument from her because I go in with these harebrained ideas all the time and she'd be like, no, you know, and she's amazing. I think she's one of the most intelligent women that I've ever come across, you know, and she's like amazing in her field. So honestly, she's probably one of the only people that if she tells me no about something, I'll be like, okay. So anyway, I went into her, and she had done all of the research on the positive study here in Ireland. And she said, you're an excellent candidate for it. So she gave me the go ahead. She said, you know what, you can just stop right now. You can stop your Zoladex, you can stop your anti-hormonal stuff, stop your treatment. We'll send you along for a CT. If the CT is all good, you're free. You have 2 years to see if you can, get pregnant and have a baby in that time. And I was, oh my God, that was the first time I think that I smiled in her office. I was floating on air. I was so happy, you know. So I went off, and ovarian function did return. I had a period. I was like, yes, like finally everything that we've wanted is going to happen. And then I got a phone call that the CT had shown up bone mets. How do I even start this video? I think I need to just put it in the title, what this is about, because I can't even say the words right now. As I said, I was in a really good place mentally, and I think I took it pretty well, The treatment was basically being back on the Zoladex and the anti-hormonal therapy. And then there's a targeted therapy, which is also oral, that you take it in tablet form. So it wasn't chemo again. It's not as harsh. And after a certain amount of time, I've adjusted really well to it. So I think I feel even better than before, because that whole anxiety about what if it comes back? What if it comes back? It came back, and do you know what? It's actually not the worst thing in the world, So I think there is times that are sad. The sad times are always to do with my kids. If I have metastases to anywhere else, so whether that's the liver or the lungs or other bones, the treatment that I'm on right now is going to be the exact same treatment, So it's a year now since I was diagnosed with stage 4 and started on the ribociclib, or Kisqali is the brand name that it's known by. And I take letrozole as my anti-hormonal. So that drug, the way that it works is that it targets fast dividing cells. So that is the cancer cells. It works in conjunction with the letrozole, which is fighting the estrogen, and then the Zoladex shuts down your ovaries. So everything that I need, I am getting right now. And then, so my tumors have not shrunk. Some people, they do, and some people get no evidence of disease, even in stage 4. Mine have not shrunk. There hasn't been any change. So I'm considered stable. But for me, that's good news. The fear that you have of the cancer coming back, how much is that interfering in your life? Is it stopping you from doing things? Are you saying, no, I can't book a holiday for next July. I don't know what will be going on in my life at that stage, or no, I'm not going to sign up to do a master's, because what's the point? I could be dead. Like, I won't be able to use it or whatever. And you have to ask yourself then, is that fear taking over so much that it's actually taking away from the enjoyment of your life? And if it is, then what you have to do is start doing those things. That's it. You say, I'm booking the holiday. I'm enrolling in that college course that I've wanted to do my whole life. I'm buying that dress, and I'm going to figure out where I'm going to wear it to. Like, the girls and I are going out on Saturday night and I'm drinking the alcohol and I'm going to smoke the cigarettes and I don't care or whatever, you know? You have to start doing those things. And when you start to do those things, that's where the happy life comes from. Because you don't find the happy life, you make it, you know? That's it. And then as time goes on, the fear becomes less. It doesn't go away. It's just that it's not the strongest thing. It's not the strongest emotion. Your happiness is, you know? And it's just about, do not let that, I can't swear, but that asshole that is cancer get the better of you. Cancer is not in control. You are.